Hi, I'm David Hahn, and I'm a vascular surgeon here at Penn State Hershey. If you're watching this video, you've either chosen a career or are considering a career in vascular surgery. Either that, or you've got way too much time on your hands. Either way, I'd like to spend just a few minutes talking to you a little bit about why I chose a career in vascular surgery and why I chose to come here to Penn State Hershey. So first, let me tell you a little bit about myself. I grew up about an hour and a half away from here, halfway between Philadelphia and Wilmington, Delaware, in a small farm town. It was a small town, and small towns are really home for me, which is why I've come back here to Penn State Hershey. I went to Penn State for my undergraduate degree, and I started in a 6-year program between Penn State and Jefferson Medical School with the intent to graduate from both institutions in 6 years. I dropped out of that program, stayed at Penn State for my entire 4 years, and had a wonderful time. I then went to Harvard Medical School, and then did my general surgery residency at Emory University and Grady Hospital in Atlanta. After that, I did my vascular surgery fellowship at the Mayo Clinic in Rochester, and then came back to Pennsylvania, where I practiced at the Geisinger Clinic in Danville, Pennsylvania for a few years, before coming back here to Hershey, Pennsylvania. It's now 2012, and this is my 10th year at Hershey, and I've enjoyed every minute of it. My career path to vascular surgery hasn't really been all that straightforward. I originally wanted to be a pediatrician, and in fact I spent a summer shadowing a local pediatrician when I was in college, and then when I did my pediatrics clerkship as a third-year student, I really thought that was the career for me. I enjoyed being a part of the longitudinal care of patients and their families, and then when I did my surgery rotation, I found that to be even more challenging, because here I thought I really enjoyed the technical nature of surgery, but I didn't find that there was as much attention to anything outside of the acute needs of the surgical patient. Well, I really couldn't have been more wrong. I was lucky enough to spend a 4th-year clerkship with a pediatric surgeon and found him to be a wonderful role model. And he really showed me that there's a lot more to surgery than what happens inside the operating room. The preoperative, postoperative care, and really the care of the patient and their family is an integral part of what we do. I found the career that I love in vascular surgery because it's a very technically oriented field. It requires a lot of attention to detail. Not that other fields don't, but I find the technical needs that are encountered during a vascular reconstruction to really appeal to me. I also find it enjoyable to be operating on different parts of the body every day, and yet we still focus on really just a couple of disease processes, such as arterial aneurysms, or atherosclerotic occlusive disease, or venous disease. So we really get to focus on just a few specific diseases, and yet really take care of many, many different problems. And for me, I really enjoy being a part of the patients and their families' lives over a long period of time. We'll see patients in the office who will eventually need an operation, but it may not be years until they need it. Similarly, we'll see patients who need an operation right away, but then we'll continue to follow them for years and years to make sure that the disease doesn't come back, or that they don't develop similar disease in other parts of their body. So we really get an opportunity to see patients not just through their illness, their intervention, and their recovery, but also to be a part of all of the pre- and post-operative care and the longitudinal care that goes into people who've got what is really a lifetime disease, such as atherosclerosis. And so I'd like to wrap it up by telling you a little bit about why I chose to come back here to Penn State and to Penn State Hershey. Being from a small town, I really wanted to practice in a small town. But being at a big academic medical center such as Penn State Hershey, I have an opportunity to really see patients and diseases that are really much more complex than you might see in a very, very small town. And yet we have all the benefits of being part of a community, seeing my patients in the grocery store, at the bank, at the ball field. I think that's important, and I really enjoy that kind of career and that kind of environment suits you, then maybe this might be the right place for you.